At the end of the day, your patient's not always going to remember what you said or remember what you did during therapy, but they are going to remember how you made them feel. My name's Abigail Nartker. I'm a speech language pathologist at Mercy General Hospital, and I have worked for Dignity Health for 3.5 years. My mom actually was a speech language pathologist. I actually always thought that I was going to work with kids in schools. That's what my mom did. But actually, when I was doing my clinicals in graduate school, I realized that I actually didn't love my child placement. So I did a rotation in a hospital and I fell in love. So ever since I graduated from grad school, for the last 11 years, I've worked in various adult rehabilitation settings. So the field of speech pathology is so much more than just speech. A lot of what speech does in acute care is swallowing disorders, and many people don't realize that speech therapists actually treat swallowing disorders. I actually have an autoimmune disorder myself that flares up from time to time. So I've had to have speech therapy, occupational therapy, and physical therapy myself. I've been the patient. I know what my patient is going through. I know how hard and challenging it is when you're trying to relearn and rehab a specific skill that used to be so easy. So I think from that perspective, it's shaped who I am as a clinician in a way, because I know how to approach them. I know how important the quality of care is and how important it is to have someone to cheer for you. And so I want to be that cheerleader for my patients every day. I love the culture at Dignity Health, especially the culture on our acute rehab unit. We work very closely as teams, which, in my field, this is the first time I've ever truly worked on a team where you have teammates, you're assigned to patients. And what I love about that is that everyone can collaborate, as they're working with the patient. I feel like working on a team like that, having that community really allows us to look at the whole picture and provide the best care so that our patient is as independent as possible when they go home. This is the first job that I've had in my 11 years of experience where, if I were admitted to that unit or my family members were admitted to that unit, it doesn't matter what day it is, what time it is, every single person that I work with is amazing. I would have any of them care for me or my family member, and I think that says a lot for a community.